thanking Professor Shafi for really taking the time out to join and support Medical Festival Asia. It's really a pleasure. I know I was saying it's an early hour for him, but we had to have him on this festival, and really for yourself and having had a personal interaction previously to really set the stage for us and have this fireside chat to really delve into where digital innovation is going. And I know for many, digitization really began in 2020, but for yourself, it began, I believe, since the day you started learning medicine, if not before that, with the number of accolades that you've had and the real progressive nature in which you've looked at the healthcare industry is truly admirable. So without taking much longer, I'd like to welcome both our panelists. We have with us as moderator, Dr. Ravi Shrestha, General Manager and Senior Director, Global Healthcare IT at Canon Medical Systems. And we have Professor Shafi Ahmed. His accolades are many. Let me simply say that he's a multi-award-winning surgeon, teacher, futurist, innovator, and entrepreneur. He's a 3 times TEDx speaker and a keynote speaker at the faculty of Harvard Medical School. The innovations he's had, I will allow the both of yourselves to really delve into them, along with the views on where the future of healthcare and digital transformation is going. So on that note, I will pass the floor to both of our panelists. Thank you again for taking the time out, and to everyone attending and watching today, both on Medical Festival Asia, on Zoom, and of course, Facebook Live. So the floor is yours. Thank you so much.
Excellent. Thank you, Varun. Hello, team, and welcome to our Future Series. And this is a keynote presentation within the Future Series. And I'm Ravi Shrestha, as Varun just mentioned. Apart from working in Canon Medical, I'm also part of the Global Health Asia Pacific team within Medical Festival Asia. Today, I am so privileged to introduce and say that we are joined by the very rock star of digital health and digital surgery. As his day job, as you can see here, Professor Shafi is a consultant cancer surgeon at the Royal London and also St. Bart's Hospital. He has been awarded the 2018 Future NHS Award by the Members of Parliament of the United Kingdom, and also has been elected as a member of the Council of the Royal College of Surgeons of England. Professor Shafi, the surgeon, is also an innovator, a futurist, and as Varun said, an educator, and also a humanitarian, and is one of the top 20 global influencers in digital health. So we are really privileged to have him here. I've known Dr. Shafi for a few years now, and every time I open up my mouth and talk to him, I sense that he is an innovator. As an innovator, Professor Shafi is the most watched surgeon. And in this age of virtual conferences, I think it's very appropriate that we have a virtually most watched surgeon in front of us. And he performed the very first virtual operation that was watched by over 55,000 students and trainees in about 140 countries. And it reached 4.6 million people on Twitter. As a futurist, he is developing immersive collaborative technology to redefine digital health and digital surgery. He is definitely a positive disruptor of medical education using the best of technology and clinical sciences. In 2019, as Varun briefly mentioned, Professor Shafi was a runners-up in the British Academy of Film and Television Arts BAFTA Awards for something called Operation Live. Operation Live, Professor Shafi and his team performed live operations in this pioneering surgery series, showcasing life-changing surgery that unfolds in real time on the screen. But most of all, he's a very humble human being, leading by example. For example, in the running and working of the Nightingale Hospital as part of the continuing COVID delivery that's happening even today. His mantra is quite simple, is to translate technology into clinical practice and make it accessible and affordable. So I'm sure you're all super excited, and our team at Global Health Asia Pacific invite you to imagine, listen, and learn during this highlight keynote session of the Future Series of Medical Festival Asia 2020. I'm very humbled and very pleased to present to you Professor Shafi Ahmed and his keynote on the future of healthcare and digital transformation. Professor Shafi, over to you.
Thank you so much, and I hope you can all hear me. Thanks to Varun, of course, and Ravi, and I hope I can live up to that expectation that you just put out for me, Ravi. Let me just share my screen first and foremost, make sure we have everything working. Okay, there we go. Hopefully you can see my screen, and what I'll do, I'll share my screen in future forward. Okay, here we go. So we're going to talk a bit about the kind of future, and of course there's a spelling mistake already on transformation, but let me just go to the first slide. So my role here is just to really open your minds up to what's possible in the future in terms of the reality, I guess, that we're facing of healthcare and also medical education. This is a video that depicts the future. This was recorded by Anthem, one of the largest insurance providers in America, who I worked with briefly on a project. So this is just a glimpse of what the future might present. Quote at the end was by Abraham Lincoln, who said that the best way to predict the future is, of course, to create it. What we're seeing now during the pandemic is this change and acceleration of technologies. One thing to remember is that we've been, I guess, really fortunate to live in 2020 because we have the availability of many technologies coming together at the same point of human existence, an inflection point for humanity, whether it's 5G, whether it's AI, whether it's immersive realities, whether it's genomics. We have a richness which we've never had before. So don't think about one technology, think about all of them put together and how they combine their efforts to make healthcare better. So an opportunity for all of us to redesign, reimagine, and rethink the model of healthcare. My other work is around global health, and of course it's a global health series, so it'd be prudent to spend a little time talking about the challenges facing our civilization. This is the WHO workforce planning for 2030. And we're going to be about 14.5 million health workers short in 10 years, maybe more than that, of course. So we have a problem with staff numbers, with workforce planning in the future, which we're not really adjusting to at the moment. The second point, of course, is that we've seen hospital and healthcare costs rising. This is the GDP of the major countries around the world. You can see how every country in the world is putting more money into healthcare. So it's becoming unaffordable, because we are putting a lot more resources in. So how do we overcome that burden? We have to redesign, reimagine, make healthcare more smart and more efficient. And technology gives us the opportunity to do that going forward. Otherwise, again, the costs are going up because of more chronic diseases, increasing age population, etc. So we've got a challenge there. We're also going to be guided by the, global regulators. Here at WHO, recommended about 18 months ago, about 10 solutions for digital health. Now, I think after pandemic, this will be revised and there'll be many more digital interventions recommended for the global community to work on. So we've got this whole momentum now around digital solutions providing care. For the last 9 months, we've all been affected, of course, by the COVID pandemic. And if someone said to you, what would happen when time gets compressed? We found out we've compressed about 5-10 years worth of innovation into about 9 months. We've seen changes in the rules, changes in the regulators, increasing translation to clinical practice, new ideas, new innovations. We've seen that humanity can actually think differently and reclassify the way they manage their work. If you talk about the first things, how do you create the future healthcare workers of tomorrow? What I call either digital healthcare worker, or in this case, the digital doctor. We have to go back to medical school. We have to go back to nursing school. We have to put in measures to ensure that we have the generation of tomorrow that's fit for purpose. About 6 years ago, I saw that vision. I said, we need to change the way we deliver our medical education. I was the associate dean at the time, the medical school at Barts, which is, a medical school that has been around for a number of years. So we thought, let's embed a new course, and we called it Bio-Sex Medicine. And our students in the third year are taught on innovation, entrepreneurship, technologies. They're taught by coders, developers, UI UX teams, entrepreneurs, etc. And they get away with ideas and generate ideas. They talk to their teams, they form teams and bring out a user case on a business Canva and a pitch to Dragon's Den. So it's thinking about, look, how these new future doctors are going to be relevant. And now, of course, they're relevant now because we've seen the changes taking place in the medical school. Briefly looking at the future of health and care system, we separate health and care. We've seen how care system has been really not, it's not been supported in terms of money and capital expenditure as well as it should be. So we're talking about a digital place in the future. It's going to be connected through primary, secondary care seamlessly. Of course, it'll be data-driven. Data is our biggest asset that we have. If we collect it properly, we'll have personalized care in the future. We want an integrated system. We want people to understand how this whole thing flows properly. And the key word for me in 2020 is collaboration. We've seen collaboration now with industry partners, with universities, come to the forefront to deal with the pandemic, and that will carry on going forward. So we are going to have a new normal. This is I work with Vodafone as the ambassador. This is the kind of thing we're thinking about the future. This is a connected hospital. Hospitals in the future need to be smaller, more mobile, less beds probably, because we need to keep people out of hospital. We have a mission to keep people in wellness rather than sickness. That means shifting the kind of the work away from secondary care into primary care and social care. So you can see how the connected healthcare system, whether it's the environment being assessed, smart parking, connected ambulance, for example, etc., is going to change the way we access that healthcare system. Inside the hospital, it will change, of course. Any care provider will be more digital, will improve the patient experience, and will be assessing and monitoring as they walk around the rooms and with wearable sensors measuring their data. Of course, we're moving care right to the community. We've seen with telemedicine taking off, that actually people want to be more remote. They want to be having more immediate access, more convenient access to healthcare. And of course, this is where we are. We've seen the vulnerable patients at home, for example, and access to telemedicine, giving information and knowledge to them, as well as having wearable sensors for data for the chronic diseases and virtual consultations. So this is the kind of model shift. Of course, I do a lot of work globally. I'm an advisor to Abu Dhabi Department of Health. And you think about these countries and what they do. This is a model here where we have now a country during the pandemic creating a central healthcare information exchange where all 50 hospitals are almost connected with data, real-time dashboards, managing the flow of patients through and out the hospitals and the healthcare system during COVID. So this is what's possible. We connect all the healthcare system properly using proper data. And of course, we've now looked at the most important part is patient experience, which has changed immeasurably. We're not going back to what it was like before the pandemic. We'll talk about more prevention, more lifestyle changes. We've seen mental health being affected during the pandemic and increasing in problems. So how do we prevent some of these problems in the future? We've seen total triage, the entire triage happening outside the hospital, whether it's chatbots, whether it's telemedicine or telephone triage, it's total triage. We've seen patients with COPD and diabetes managed differently in the community. We'll talk about it in a moment. We've seen more personalized care. And of course, we've seen this whole concept of remote monitoring. If you look at 100 years ago, we were talking about the futurists of 1924, looking at a TV screen to be able to diagnose people remotely, that they call this a radio doctor. Actually, what they talked about 100 years ago was the concept of telemedicine. And here we are, it's taken off. In the first month or so of the pandemic, healthcare systems were up by 5,000 to 8,000% using telemedicine as a primary consult. And actually, telephone's also being used here in the UK for triage. And it's 24 hours. Many companies out there now offer those services. So it's changed. Outpatients are empty in the hospitals. We don't need that space anymore. Not going back to before the pandemic. Now we're seeing people actually use telemedicine appropriately. Who would have thought this would have been happening years ago? If you go to China, this is about a year ago, before the pandemic. Ping An is an insurance company in China, of course, and they use telemedicine. And what they were claiming to have was 300 million active users. This is telemedicine on steroids. They were performing about 160,000 consultations per day. So you can see how you can scale technology so that it's widely represented across the nation. The future, they predict, actually will have these community providers where you can pop into a booth with a telemedicine consult. You can measure all your basic blood pressure, pulse, etc. And then if you need a prescription, you pop in next door with your smart card and off you go. So actually, do we need big hospitals? We need community centers. Can we do it remotely, have mobile centers? for point of access improvement. A year ago, you thought we were crazy to break bad news on a telephone link. This is a gentleman, a doctor in California, who was criticized heavily a year ago for breaking bad news on a kind of a smart machine, if you like. Actually, now it's more relevant. We're now breaking bad news of patients' cancer diagnosis, people on COVID, can't see their families, the linking with telemedicine. And we're seeing now this way of actually communicating differently. So now that year has changed. Can you imagine? It's been disruptive. A year ago, it was unheard of and difficult and be criticized. Now, of course, it's normal. See how things change and how you can challenge the dogma and tradition of clinical practice. This is my clinic at the moment. This is what I do. On the left-hand side, you see my electronic health record and my home laptop with a software for the consult, telemedicine. And on the right, if I'm there, I can just do a walk around the hospital and to see the patients. Before, I did this 5 years ago. Of course, people were a bit concerned that this was a bit difficult, not real, but now it's changed. It's normal. People are happy to be seen by a consultant on a machine. If you look at sensors and wearables, I was talking about earlier, this was a picture from Time magazine a few years ago, where we're going to be in the future monitored intensively with all of our kind of biometric data being passed here and there. We're seeing now a plethora of, I guess, devices, whether it's a smart watch like the Apple 6 measuring your blood pressure, not your blood pressure, so your pulse rate and your oxygen saturation, which is new, or there's a skin where you just, this is Profusor, where you can just monitor various levels of oxygen, for example, based on your smartphone, the nanobot in your stomach, or whether indeed it's a skin surface. We have this whole multitude of ingestibles, injectables, and wearables coming through the market. Of course, reality, of course, we're now moving to this area. We're now seeing AF, for example, bottom left, being measured by a remote device, the Alive Core. We're seeing people in the community measuring their own atrial fibrillation being monitored remotely. We've seen diabetics being injected with devices for continuous blood glucose monitoring. And also we've seen artificial pancreas now get FDA approval. So we've seen these kind of devices to give real-time data. And now, of course, body sensors coming in to measure all your physiological parameters in the future. AI is big, of course. A few slides about AI very quickly. AI in healthcare is going to be important in 2021. It had much promise, of course, before, but now we're seeing the use cases coming forward. Excuse me. So the AI will be used in diagnostics, in drug discovery, as we've seen recently, in chatbots. Also, I'll talk a bit about AI in surgery. There's no shortage, of course, of companies working in AI. There's a plethora of companies, whether they're using natural language inputs or patient data, biometrics, or indeed operational data from providers. We're seeing the whole area of detection, triage, diagnostics, treatment management, and monitoring outcomes. So we're seeing now a wide range of companies coming in. And also we've seen the kind of utilization. We've seen this Abu Dhabi, where they've launched the Mohammed bin Zayed University of AI to actually bring in for free students from around the world to be taught on AI, so they can actually disseminate information across all disciplines. So we're seeing the rise of AI. Of course, it's used in dermatology, pathology, DeepMind, of course, in the UK used it for diagnosis of early retinopathy, using the algorithms. We've seen many people use it for images like chest x-rays, chest CTs, etc., looking at the impact of that. And we've seen how it can automate, improve efficiency for these kind of targets. Recently, of course, NHS X released all their images to the public domain, so people could actually work on it. And we've seen now companies trying to predict the COVID outcome using these images, image-based. My own specialty of colorectal surgery, this is a polyp detection sequencing. So you can see this is called GI Genius from Medtronic. What you can see is the real-time AI will pick up adenomas that we may not see on direct inspection initially. It will direct you, and hopefully that will avoid future cancers, to prevent future cancers. We've also seen the diagnostics. Here's the butterfly system, for example, ultrasound. Imagine the future where ultrasound can actually then be managed remotely. The AI interfaces, so you can predict what's going on just by anyone shining that on the patient. I said earlier, we have a healthcare workforce shortage, but surely the way to overcome that is take with expertise, probably make it more fairer by letting people use these devices with little or no knowledge, so you can actually predict things out in the community or wider world. We've seen chatbots coming in, of course. We've seen these kind of chatbots come in, whether it's Ada, Babylon, or even Sensely. Many of the chatbots coming in as a symptom checker. And this will be your first point of contact, of course, in the future. It won't be a human being, it'll be one of these. This is a quick video from Babylon.
Hi Louise, my name's Dr. Kultag Archer. Nice to meet you.
Hi. What you're seeing here, interaction between doctor and patient, facial recognition, assessing the patient's emotions, if you like, letting you know what the cues are. There's voice to text, real time, and AI working with diagnosis on the bottom. All at the same time. This is the kind of thing we see an interface from telemedicine, much more advanced in the future, with all the technology available to us. Alexa, of course, and voice technology is going to be important in the future. We're seeing now companies think about how to use Alexa. Alexa will probably be, or Google Home, for example, be a primary contact for many patients for chronic diseases, diabetic management, giving advice about your medication, about your treatment plans, etc. Maybe even some cognitive behavioral therapy. We're seeing the change. This is Alexa doing the same thing earlier.
Hi, Alexa. I want to speak to Babylon.
Hello, Louise. How can I help you?
Well, I've been feeling a bit dizzy recently.
I'm sorry to hear that. Can you tell me a bit more? Do you feel like the room is spinning?
You can see in real time, these voice-activated AI systems will be able to monitor and help support you and guide you through the diagnostic process. We've seen the voice technology be used by companies, for example, to predict your instance of cardiac failure. So here we are. This is a company Beyond Verbal a few years ago. What they did was they got you to speak to an app every day. They analyzed your vocal biomarkers, and with that, they could predict the onset of cardiac failure 2 weeks before it arrives. So that would avoid unnecessary hospitalization, unnecessary costs, and unnecessary morbidity. This is my diagram of the future. Say you have hemoptysis, coughing up blood, and you want to go and see somebody. First of all, you go to the symptom checker in the top. You can put your questions in, it'll analyze your results like a symptom checker, using basic AI. And then, of course, it will say, here we are, we're concerned, go for a chest x-ray or CT scan. You go off for that. That'll be analyzed immediately by AI and give you the results to your GP or yourself on your smartphone almost immediately. You then go for biopsy, and the biopsy will be targeted in the chest by a robot. This is going to be robotic assisted biopsy, where it navigates using 3D mapping of the CT scan using AI. And of course, you have the pathology report from that, which is AI driven. Then you go and have the operation, which will be done remotely by a robot using 5G technology in the future. So this is my model, I think, of the future way we're going to manage our patients. A lot of my work is around extended reality, and I have to share some stuff with you here about how we're going to change the way we connect with people. So extended reality is, on one hand, augmented reality, on the other hand, virtual reality, in the middle, we've got mixed reality. I'll talk a bit about holograms and avatars. So this was a kind of the future of kind of AR, and this is kind of me on the left-hand side doing the world's first Google Glass operation back in 2014, streaming live from wearable technology. You can see where we're now going ahead with AR in the future. And so I use that model to teach a lot of people. Glass now become more better since the Google Glass was invented, much more capabilities, etc. And we'll see hope the launch of more products in 2021. We've seen companies using AR on your smartphone, on either using AR Core or AR Kit in the case of Android. And we're seeing how we now use that technology to teach people remotely. We're also seeing AR being used remotely for surgery in teleproctoring. This is Proximity, company in the UK, using their device to connect a patient and 2 doctors from the UK and the US to be able to operate and offer advice remotely. So we're now to virtual reality. Virtual reality is interesting, of course. It's something I've been interested in for a while, and here we are. It's not new. Virtual reality has been around for a while. It's just that now we have the computer capability of producing higher quality images, etc., to be able to really redesign the way that VR might work in the future. These are products of today. They're untethered. They're not connected to a computer. They have 6 degrees of freedom, and they have motion tracking, eye tracking, hand tracking. Very clever devices. Really think that actually I think the Oculus and the other mobile platforms have transformed the way we can think about VR in the future. One of the key things about VR, of course, is that it's now useful in medical therapy or virtual therapy, whether it's stress, post-traumatic stress disorders, pain relief after an operation, for example, and we've got many, many papers on that at the moment. We've seen the patients' numbers accrue in clinical trials. Cedars-Sinai with Brennan Spiegel and Diane Juris from On Comfort in Belgium have accrued over 60,000 patients in clinical trials around the world, showing the kind of ability using virtual therapy and clinical hypnotherapy and integrated techniques to improve patient outcomes or experiences in the future. In the UK, we've seen chronic rehabilitation and therapy for COPD and asthma using VR therapy. And also we've seen now using pregnancy during labour to overcome an epidural, to allow people to have actually taking VR therapy, distracted therapy, to overcome some of the pain you may have during pregnancy. I used the VR for the first time a while ago to do the world's first operation in virtual reality. This was me mounting a 360 camera on my in my operating theatre, and then transforming around the world so that people would actually be in my operating theatre watching a live operation. In fact, this was the first time this was used back in 2016.
People around the world using low-cost technology, a simple VR headset, to actually immerse themselves in operating theatre around the world.
So we've experimented. Our company, Medical Realities, has created immersive experiences. We've been pushing out for a while now, and obviously now more relevant because people have remote training. This is the VR surgical training platform that we released, so people can actually interact with the platform, learn from many operations that we've recorded globally, and generally just navigate through a different kind of experience, if you like. Here you can see recorded videos in 360. You can interact with them with hotspots, etc. And you can go through a whole model of learning within the VR platform. Video quality can be used here. And then interact with exams and slides and information, also, and CGI simulation at the very end. Excuse me for my coughing. So you can see the platform's working, and it's downloadable on any platform at the moment, so feel free to play around with it as you wish. This is the CGI animation that we created for procedures. We're seeing now people using for simulation. This is also VR, looking at orthopedic operations, and actually using that to train people remotely, which makes sense given the fact that there's been less face-to-face contact over the last few years. Of course, VR is useful. It shows it's more useful for people. They learn quicker, they're more comfortable with it. And we've seen an increase in 80% of retention rate with VR compared to traditional platforms like online platforms. Mixed reality, of course, is your HoloLens or your Magic Leap devices, very sophisticated and powerful computers. We've seen that people are navigating in real-time images using that kind of overlay of CT or MRI during the operation, so to plan to make the operation more precise. For example, this is one example. And of course, another example in the operating theatre, with overlay information in real time on the patient body. This is a liver operation being carried out, for example. So in the future, as it gets better, we'll be able to predict organ damage before it arises, report structures, and maybe even localize a tumor, so you can take it out with wide margins in the future. We've seen MI used for mixed smart ambulances. This is in Milan, using mixed reality head devices remotely, so people can connect remotely, etc. So you can actually use all the information, relay it back to the hospital using the MR device. This was me about 3 weeks ago. Our students weren't able to have face-to-face contact with their clinical patients because of COVID, so I decided to do this, which was just using mixed reality. We had lecture theatre with 70 students in the space of 400 students, so well spaced apart. We then used a device on the ward. That was me on the ward, seeing the patients. We relayed back to the lecture theatre where Moderator was teaching them. So we created a new experience for medical students apart. In fact, this afternoon, we're doing a third session, and it's been really effective learning how we train people remotely using these MR devices. The other thing I'm interested in is avatars and holograms, and we've been using this kind of technology for a few years now, with a few companies trying to see whether we can do something about it. Here we are, about 2.5 years ago, we decided to do this, where we connected 3 surgeons across 3 continents using the avatars.
Hi everybody. Hi Shafi. So the HoloLens itself really allows us to reshape the way we connect people, we communicate with people, and also to be used in teaching and training. Initially, when you put the HoloLens on, it feels a bit strange, but actually within a few minutes, it becomes quite normal. You feel as though you're just discussing cases with people in the same room, for example, like we do in normal hospital practice.
We can come in and actually look at this content in full 3D. And
sort of showcasing how you can kind of connect with avatars using real-time mixed reality devices. What about using holograms? The hologram will be created and transported in 5G.
Shafi, have a look at this.
Yeah, let me have a look over your shoulder.
So you can see that kind of future of kind of holograms, avatars, and now that we do more remote work, it makes more sense to think about that future. This is, of course, the future of surgery, looking at how we can improve that. Now, concept of digital surgery is coming in where surgeons themselves will be more connected with robots, with enhanced visualization, advanced instrumentation, the connectors as before, using real-time data analytics to improve outcomes for our patients. We've seen robots coming in, which are much smaller, more sleeker, offering kind of this much more manual dexterity, fine control, if you like, which is great in terms of performing procedures in that sense. We've also seen robots using 5G technology. 5G is important. 5G is the enabler, of course, of many things of the Internet of Medical Things. We'll connect all of our technologies that we described earlier in this presentation. And of course, with its low latency, high bandwidth, it makes sense to be able to use that in these remote situations. Human contact will change, of course. We're now seeing brain-computer interfaces coming in with Neuralink and other companies, of course, working in the space where we connect our brains with real-time information, and we're making progress on that. This is my friend Nigel Ackroyd, who died recently, about a month ago, and actually he had the world's first real bionic arm connected and communicated by his muscles and nerves in his upper arm, and he can control that, and there is the handshake between robot and human, which we described a little earlier. We're also looking at the world of digital humans, where we're replaced by people that are going to be looking like us, created from us using protocol photogrammetry and others, using AI interfaces with technology, and they become more like...
Hi, I'm Roman, a digital human brought to life by soul machines. With me, you can experience AI like never before because I learn and react emotionally like humans.
Last few slides in the future, we're looking at, if we're looking at Mars in 2025, we're going to be traveling, of course, across the universe to implant our seeds on Mars. We're now seeing 3D printing being more and more cheaper, more affordable, and now being used for planning operations, particularly, say, in orthopedics and other areas. So we've seen now the costs come down and being more useful. We've seen 3D printers in space. This is where they sent a 3D print space and actually helped a patient, one of the astronauts who broke his finger by making his own splint for him, so he would carry on working in space a few years ago. We've seen a transition from that. We've seen the whole world of transplantation change. We're now seeing almost the 3D printed kidneys and printed hearts in the future might be able to be manufactured, relying less on human transplants itself, but more regenerative medicine. And skin, of course, is also going to be improved by creating new skin using technology. We'll also talk about drones, of course, and we'll talk about the future. This is a kind of avatar medic, someone I work with, and this is like looking in the future of how we do remote work. On the right, you'll see the drone in New York transporting a transplant from one hospital to another, engaging very quickly, saving plenty of time for that to be delivered. We're seeing now drones now being offered in remote areas, maybe in space, but also space offers an opportunity to work remotely in the world. So we can actually transport blood product, for example, or indeed organs we've seen here, and also firsthand maybe monitor the patients, do first aid treatment. And the exercise this year is going to be on this kind of concept of remote medicine using robots or avatars. Of course, last thing here is we're now seeing these kind of Iron Man devices, where this is Richard Browning, this is a mountain rescue, saving valuable time to get to a patient, for example, maybe critically unwell in the out.
Hi Dorian, so nice to meet you. So I'm Dr. Dewberry and I'm here to take the neurology exam.
I just need you to relax and just follow my instructions, okay? First thing I need you to do is to keep looking directly at my eyes and then follow my instructions. So this is the pen light and I'm going to shine it into your eyes now. Okay, keep looking at me. That's great. That's right.
So what I've just shown you over the last few minutes or last half an hour, 35 minutes or so is around this future of different technologies, how we're using them today, how the COVID has accelerated change. And I'll leave you with one final quote by William Gibson. He talks about the future being already here, as we've seen, but it's just not evenly distributed yet. It's our mission, of course, all of us, we have that mission to ensure that these kind of healthcare ideas, technology, innovations are more available to more people around the world very quickly. So I will stop sharing my screen and then we can go to a Q&A with Ravi.
Professor Shafi, thank you so much for sharing your insights into the future of tomorrow, right? And highlighting specifically how the power of digital healthcare can transform patient care today and into the future. As I said, in terms of the Q&A session, as this is the future of healthcare and digital transformation, we have the benefit of a surgeon, a futurist, available to speak virtually, right? So that is wonderful. So what I'm going to do over the next few minutes is just basically take the audience in terms of building towards the future, looking at today, the journey, and the future, right? And I'm going to basically build up some questions so that we can see where your head is and where the reality is in terms of using those nuggets of technology that you mentioned in the last phrase, so that we can distribute it evenly, right? So in terms of even distribution, today, as part of the transformation, we saw what could be done inside the hospital of the future with the new integrated, fewer bed hospitals that you saw. In your job today as a practicing surgeon, saving lives that you do every day, how are innovative digital tools making a difference every day at the institution?
So what we've seen, Ravi, I think, is a more tolerance of innovation in the hospital. That's the first thing. Before, healthcare workers generally were risk averse, or hospitals, as you know, I'm sure from your experience, Ravi, working in the industry, they've been risk averse, not prone to change. That's changed. That the mind shift has been there, people understanding and using new technologies. And the pandemic for us has been really useful, no question. We've really translated these kind of innovations much faster than we've ever done. So before, the regulations have changed, make it easier to implement these kind of technologies. We've seen more collaboration with industry partners. We've seen, people using telemedicine immediately. Before they were resistant to it, now it's commonplace. We've seen people having remote sensors, wearables, and managing diabetics, for example, and COPD remotely in a different way that was not measured before. It was more about interventions. So we've also seen ideas like, the AI stuff I was talking about coming in. We've seen the test and track apps coming into the healthcare system. We've seen more data being shared, for example. So all the fundamental issues we had before are now being addressed, I think. So we're in a better place. It's not perfect, but this kind of transported us to a new kind of start. It kind of springboarded innovation into clinical practice. So I've seen the way we use remote care, the way we connect, the way we use digital technologies. It's just become, the language, if you like, has become more, demonstrable. People understand the language of digital technology, which they didn't understand before. Maybe scared by some of the ideas that we're giving. Now saying, let's adopt them quickly, from governments down to hospitals and down to individuals who are now saying, actually, we're ready for change. So I think that's what I'm seeing now, Ravi.
Right, excellent. And one would say, when I was in the UK working with you guys and the rest of society, tolerance, change management, which was like 30% of all the cost of the national program for IT, and acceptance were three very difficult things in front of clinicians, right? And I would beg to ask the question to our society: was COVID-19 pandemic really required to give telemedicine, or as I call it, tele-X, the spotlight that it deserves, right? So with that in mind, with the catalyst of COVID, tele-X, which is loosely known as the virtualization of patient consultation, as you said earlier, is reshaping the whole future of healthcare today. Right? We're seeing more and more people going through telemedicine as the way of avoiding risks when you go to the hospital, where it's possible. What's your take on this transformation? In terms of the challenges to tele-X, we see lots of consultations, as you saw. And we also have potentials in terms of new types of tele solutions like teledermatology, for example.
Yeah. So there's a few issues. First of all, I think, look, we have to be careful. So I've got a bit of a cough this morning. We have to be careful that we don't create a digital divide. That's the first thing. There's patients out there who are vulnerable, who may not have access to the technologies or even understand them, for example. So it's important to ensure that as a society, as a healthcare system, we take all patients on that journey with us. So that's the first thing, so not create a divide that we can't overcome. Secondly, I think the patients are ready for change. So one of the things we've always done, Ravi, which is always I've kind of noticed, is that we've been very paternalistic about healthcare. We know best. This is what's best for you, etc. This is what we think healthcare should be like. What's happened in the last 9 months is patients have said, actually, we're okay with telemedicine. We're okay with having convenience at our doorstep. Actually, what did you do before? We're kind of ready. So that has changed. Patients are more demanding now around their own healthcare availability, which is really interesting, very important. So that creates a new fabric of social conditioning. It's almost like re-engineering society to allow for different healthcare systems to evolve. Yeah, the expectations have changed. So now we've got an open door. We can implement those changes very quickly, and patients are actually much more receptive to new ideas. And telehealth is important. You know, remember, I'm not sure you remember the hospitals in the UK in your time, Ravi, you go into an outpatients and it's teeming with patients, people hanging off the rafters, can't get in, worry about their car park charges because of delays and delays. You go to outpatients now, Ravi, it's empty. You see just a handful of patients who need to be seen. And so what we're going to have now is more remote, less patients in hospital using telehealth, for example. They'll be those that are vulnerable, that want to be seen, maybe with cancer diagnosis, so important things we need to break bad news, etc. Maybe in the hospital, for example. So that will save costs entirely. So this whole transformation into reducing costs, making it more smarter, is shown and demonstrated by the use of telehealth. So, and in the future, the whole triage system will change with the chatbots. Your first point of contact would be a chatbot, there's no question. A symptom checker to tell you about what next steps are, taking away the volume of work from the healthcare system, allowing those patients to be seen to then to be seen and managed appropriately. So these are the kind of smarter solutions to overcome some of the problems of expenditure and the lack of healthcare workers.
Absolutely, and technology, of course, is the key. And you know, if we look at the breadcrumbs of workflow, as we look at telemedicine and why it's been accepted so well, patient demand is a big tick, as you rightly said. The acceptance within healthcare is a big tick. I'm still looking at a couple of challenges that exist out there, which, you know, I'm just going to highlight those. One is practically some of the exams cannot be done remotely, right? For example, diagnostics. If you look at pathology, if you look at imaging, which I'm involved in, as you know, we both are. Ophthalmology review, for example, right? Those cannot be done remotely, and I'm sure over time with technology coming in, we will overcome some of these modality barriers, if you like. And you know, you mentioned Babylon, and there was a classic example of that within your videos, which were wonderful. Thank you very much. In many countries, the legislation also do not allow for example, new prescription drugs to be dispensed as a result of virtual consultation. So those are some of the practical challenges. And what's your take on these and the changes that are required from a regulatory and healthcare process so that telex would be much more mainstream to overcome the challenges?
Yeah, so a really good question. And you're right, some of the rules, regulations lag way behind. They're kind of prehistoric almost. Yeah, it's always been the case. Technology drives change. It takes a while for the regulatory bodies to adapt accordingly. As I said before, the 9 months of the pandemic have allowed us to relax those rules slightly, to implement change much faster. So we are seeing a change in people's perceptions, and I think the pandemic has helped that. I think you know, as we move forward, as people are seeing these kind of these new types of arrangements with telex or telehealth, we've seen a better dissemination. People understand the benefits now. They're seeing the benefits they weren't before. It's hard to prove. You know, when we introduce new things, of course, it's about showing how money either will be saved or indeed you can bring better quality to patients. Here we're doing both. It's better quality, more accessible and cheaper with good outcome. So it's almost becoming defining how we implement those changes. The hardest part, as you mentioned earlier, is about change management, of course. We bring new technologies into an institution. It's not about technology. Technology is the enabler. It's in the back end, supporting clinical practice. The harder part is change management. It's changing the way we think. the way we manage healthcare, right? Change the mindset of an individual in that healthcare organization. So I think we have a role, all of us, at leadership level, at hospitals, at government, saying how do we change quickly in this scenario? So these countries talk about in terms of drug prescriptions and taking away some of the, and allowing things to progress, are going to be happening in the future. What they'll see is other countries do similar things and move on, they'll be left behind. So hopefully that whole kind of, this will kind of diffuse these changes into other areas around the world. Remember, other countries that we don't think are that transformative, they are. If you go to Africa, for example, they've had mobile money for many years. They've been very digital in their way they've been working. If you go to places in Africa, you'll see digital technologies coming from remote care, for example, accelerating change. So I think there's a lot to learn from around the world who are implementing change quickly. And one of the things I always say in these kind of conversations is that this is a global pandemic requiring global solutions. What we've seen is that global community come together to kind of influence that kind of change for the future.
Yeah, absolutely. And in terms of global pandemic, I've got two main points with regard to legislation change, just to add to what you've said. So if you look at FDA, for example, they're relaxing a lot of rules right now, and within boundaries, of course. There are special dispensations specifically with regard to COVID type solutions. So for example, within our company, we're developing and delivering a lot of infectious disease solution based on that dispensation, specifically around lung density analysis, for example. And it's great. It's great to see FDA change their spots in that context, right? And with AI and all the work that you're talking about, there is realization and there are discussions between us as vendors and yourselves as clinicians and FDA as regulatory bodies, where they understand that AI is much more about adaptive learning, right? It's very different from software as a medical device. And so the rules are changing to accommodate all of that, which is great. So in continuing with that journey as we go into the future, right? So the last question in terms of today and the journey is about what was your motivation when you performed the world's first virtual reality operation, which was obviously viewed by the rest of the world?
Yes, so look, I performed the Google Glass operation about a year or two earlier to show we can.
2014.
Yeah. So I did that, and that was obviously a big change for a lot of people. It was 6 years ago, remember? I always thought that we had them more remote. And we did that, which was successful at the time, and that was a broadcast operation using Google Glass to about 14,000 people. And I thought, okay, that's great. That's more remote. That's kind of telemedicine. What about bringing people to you into your operating theatre? And VR was the natural, endpoint for that. So look, with that, my hospital was quite good. The Royal London Hospital, Barts Health. They supported change. They supported driving that for me. And when we approached them, they didn't say no. So fine, we can do this, but what do we need? So what do we need on the table? We need the IG team, we need the IT team, we need the governance team, the medical director, for example, to be involved in conversations. Very quickly, we had all the right people in the room together who also said yes, but what are the limitations, what are the risks we have? So we went through all that with the legal team as well. Very quickly, we transformed, the hospital was involved, and they said, okay, we'll encourage it, we'll move forward, and we took precautions. So as an organization that felt that they could change quickly, they wanted to help me, support me, is the idea going from idea to practice very quickly as well. And so all those ideas that I learned very quickly is how to engage a hospital and all the issues that we have around live transmission, to be able to do that very quickly. And we did that within a week. As soon as I had the idea, we thought, okay, let's get everything in together. What do we need? Before we went live. So we can do this if we want to. And as we've seen during the pandemic, if you do it the right way, that you can invoke change very quickly, bring new ideas into the practice, etc. So, and I've learned a lot from that, how to approach, sensitively and sensibly innovation. So I think, and that went well. It was another successful example of what we did. And of course, we kept driving change from that point onwards.
Absolutely, and of course the journey continues, right? And a major part, of that journey for you is, and for us, and for me and my team, is also education, right? Mm-hmm. Education is a massive part of the clinical, technical research and innovation and the change management, and especially with you being the CMO of Medical Realities, for example, right? I've got two main questions on this. One is, with mixed reality, AR, VR, and the things that you showed earlier, if you look at the Gartner hype cycle of emerging technologies, that has moved away from that, right? It's moved into AI more than anything else. So two main questions. One is, what is the next big transformation in clinical or surgical education that you see that will help this drive? That's first. And second is, what is your key takeaway in terms of the case and the use of mixed reality and how you can transfer clinical care? I think, I'm trying to connect both of those together because when you were here in Singapore a couple of years ago, we went to N+D and we looked at how education was going to be delivered completely differently. We looked at Google Classes and everything else, right? And we know that one big use case of mixed reality, especially augmented reality, where you can use your hands to do surgery, right? And look at your visual things in front of you with data coming from everywhere is a big, not only a hype, but a reality in terms of how it can be done, right? So I'd be very keen to understand what the next big transformation is that will help you as a clinician and a surgeon.
Yeah, so it's a really good question. So I think if you asked me about a year ago or 2 years ago, I thought the barriers were quite high to adopt either AR or VR. This pandemic has shown us that this is the right time. People want remote education, whether it's Zoom calls or Microsoft Teams. People want remote learning. We've seen doctors, students not able to go to learn from patients because of the COVID pandemic. So now it's a change. Now immersive technologies are coming in and they're going to be huge. So what I see in the future is using more a hybrid model of learning, some face-to-face, some online, and some mixed reality teaching going forward, whether it's AR, whether it's VR, whether it's wearing glasses, whether it's on your smartphone. You see a new offering, new, contents available to you for that remote learning. I think it's going to change. And the hybrid model has to change. We're now seeing universities reaching out to us and other companies saying, how can you help us teach the future generation? The other thing is about collaboration. We've seen MDT working more remotely using Zoom calls, etc., making decisions. In the future, look, you would travel. You and I both travel a lot, Ravi, in your work and my work, of course, and that's time expensive. Now we're seeing actually the futility of a lot of travel. Actually, you can do more remotely, have the conversations, and when do you actually need to be abroad? What is the point that how you need to have face-to-face? And that's becoming more limited, actually, in the sense of what we're experiencing. So can we use avatars, holograms in the future? We can do remote collaboration. And by 2030, I think we'll all be doing remote collaborations. You're going to appear in someone's kind of MR device or smart glasses, have a conversation. It'll feel much more real than it has at the moment. The image is much more clearer, with higher quality, interaction, for example. So I think so collaboration will change, and this therefore teaching will change, because then you can teach a lot of people in the same space remotely. Then soon I'll be teaching a few of my students in one of these kind of virtual platforms. They can appear anywhere. We can have a little conversation and teaching sessions with them. So I think in 10 years' time, this will be routine. Next 5, 10 years, education will be completely transformed, of course, using these new models of training.
Right. Excellent. So, that brings us to almost the final part of the future, if you like, because you're talking about 10 years time, right? And, in terms of continuing to transform healthcare, and, there are many parallel paths. There is the N=1 path in terms of personalized medicine, which you touched on earlier, right? There's also the preventative medicine, which is going to be a big part of things. And all of that is going to help us with regard to predictive medicine. So for colorectal cancer, that's going to help us substantially. And all of that is linked up to the 4th P, which is participatory medicine, right? Which is what all of these technologies are going to bring in. So in terms of the new era of personalized medicine, which is going to be the norm in 2030, for example, right? Where patient-centric care and wellness are going to be the key drivers. What would be a synopsis of a routine daily clinical delivery? You're a futurist, right? In 2030, right? You go into the new baths, the new wing of baths that's been created every day. Right? What would be the journey through the different corridors? The ICU will be a bit more full by then, I hope.
Yeah, so listen, I think, first of all, will I actually be in the hospital at all? That's the first question, okay? Yeah. Well, I need to walk through corridors. I think a lot of people were done at home. We've seen the last 9 months people working from home, right? People experiencing quality of life, being with their family, with their children, actually doing the same work, but actually being at home rather than being in the hospital. So I think there'll be opportunities. So people will be more home or remote. You have your laptop, whatever device you had, with electronic health record, with patient data. You can manage patients remotely using telemedicine. So there'll be many more patients coming out of hospital. Right. The walks in the corridor will be different. It'll be more digital. There'll be less people, of course, and there'll be more, I guess, they'll be more connected. Hopefully by then 5G will be implemented, so you have much higher speeds of transition. If you go into your clinics, again, they'll be remote. You'll only see very few patients, if any at all. Your patients will be monitored at home, so you get real-time data for them coming in, so you can actually look at them in real time on your electronic health record. We'll see smart messaging systems in the hospitals. You won't be using bleeps, they're old-fashioned. You'll be using sophisticated messaging tools where you can actually connect people really quickly on your smartphones. All the data that you're discussing, your voice, etc., will all be captured, I think, at some stage, so it will be easier. Won't be dictating letters anymore. There'll be smart dictations where in real time voice text will help you and enable you to just send letters out very quickly, information through electronic mail, for example. We'll see surgery changing when you walk into the operating theatre. It'll be voice activated, it'll be smart, it'll be AI driven with lots of data captured. We'll see dashboards. So if you look at GE Healthcare, for example, there are big dashboards now where you look at flows through the hospital, all patients coming in, what the barriers are. You can sense the flow and what's required in the hospital. So I think we'll have more dashboards, not just the hospital as a whole, but each department with its own flow and looking at what the barriers are and overcoming some of those with data precision. So the whole user experience, the user interface will change ultimately, so that actually it allows a more smart solution to be incorporated. And of course, we mentioned learning and education. That will change as you teach and train. Again, it will be using immersive technologies. So I do see fundamentally the whole experience of being a doctor being different than it is today.
Yeah, absolutely. And you mentioned about dashboards, and that's quintessential to what I do within Global Healthcare IT within Canon, right? We're designing the next generation of dashboards that integrates all the different data elements that are around the world, so that the key to this is to provide clinicians with the right data in the representative way, so that you can look at patients in a different way. And for a patient, from a personalized medicine perspective, to basically have your diagnosis and prognosis available, so that you don't focus on basically reactive medicine, you focus on preventative medicine, right? So that you can develop treatment and therapy. And in terms of workflow and integrated omics, which is the new trend, we're really hoping that the prediction of health and disease in terms of N=1 phenotype is going to be really the future, right? And all the things that you're talking about is the enabler, right? Like you rightly said. So, Professor Shafi, I know that we're nearly at the top of the hour. Thank you so much for sharing your insights into the future of tomorrow. I hope the audience, I certainly have, enjoyed this virtual keynote symposium here at Medical Festival Asia 2020. I hope to have you here live in person in Singapore maybe next year as we continue this theme, right? And thank you very much, Professor Shafi. If you have any final words to say to the rest of the team during COVID.
No, I think this is the beginning of the end. We've seen the vaccines coming out in the UK last week. We're seeing changes. I was in Dubai only a few days ago on the GITEX conference. First time we had face-to-face contact, and the world is changing. We had a tough year, of course. We've been through the worst 9 months. Now I'm seeing 2021, a new 2021, where we have more face-to-face contact. We can go back to normality, whatever that is. So I'd say people to be hopeful now. I think we're almost going to get behind the COVID pandemic. I think 2021 offers a rich opportunity for all of us in healthcare, with open doors, with new translation technologies, and hopefully we've learnt from the mistakes made in the past. So all of us in this community need to work together in 2021 and reimagine what healthcare could look like, as you mentioned. Every question you answered.
Yeah, and from all of us at Global Health, what I wanted to do is thank you very much, not only for this session, but all your work in Nightingale Hospital, for example. I've been following that very closely, thanks to your Twitter account, your Instagram account that you can see at the back of you, right? You've done a marvelous job. Thank you, and thank you for the rest of the team. You're part of the DOH committee, right? So you can take it up to Boris and the rest of the team as well, just to thank from Singapore internationally to what you do. Thank you so much. Varun, if you had any last minute things to say.
Yeah, very big thank you to Professor Shafi. It's been a real pleasure. It's been an honor. You really set the stage for digital innovation, transformation, and thank you from all of us. And also, of course, thank you, Dr. Ravi, really moderating that session and driving the conversations forward. So thank you, and have a lovely day, have a lovely evening to everyone attending, and of course to the both of you.
Thank you.
Take care.
Thank you.
Thank you so much.